few days. Your efforts, your passion, your contributions are not only recognized, but are going to be well documented in the history of Africa CDC's involvement in non-communicable diseases, injuries, and mental health. We do not take it for granted, and we ask of you that tomorrow, next month, next year, when we call upon you again to expand this work in Africa, please be available, and we shall appreciate your future contribution in terms of implementation. Third is, let me thank the honorable ministers who have physically come to be with us during the launch of this particular NCD's injuries and mental health strategy. We appreciate your commitment to NCDs. We appreciate your commitment to Africa CDC's work. We appreciate your commitment to health on the continent. Your presence here is a huge motivation for us as Africa CDC, because it clearly indicates that our policymakers at the highest levels are with us. And we thank you and look forward to working with you and your teams to initiate implementation of the strategy that we are launching today. Let me also thank the Africa CDC team and the advisory group that have been burning the midnight oil to try and ensure that all is available for this workshop. It has been a lot of work. And I would like to assure all of you within Africa CDC and the advisory group that we not only appreciate what you've done, but we intend to make you do more because implementation is just about to begin. So let us, for the sake of Africa, let us, for the sake of NCD's mental health injuries, for the sake of public health, let us keep doing what we are doing with the efficiency, the passion, and the professionalism that you have so far exhibited. And we appreciate you for that. Finally is the message that Africa CDC is committed 200% to ensuring that what we are agreeing on today, what we are launching today, is going to be implemented to the best of our resources and abilities. We shall work with each and every country, each and every partner, so that we see this strategy not only being implemented, but being implemented efficiently and to the benefit of this continent. We really, really must show that the contribution of the Africa Union is making a difference for NCD's injuries and mental health. We really must show that Africa can and is going to implement in a very efficient and visible way this strategy with good results for health and for the continent. So it's a commitment from our side, and we are looking forward to working with you. Now it is really my pleasure and honor to invite our ministers to make their brief comments so that we can all be on the same page in as far as policy commitments are concerned. And I would like to invite the Honorable Minister of Burundi to make the first comment. Burundi, you have the floor.
Chers honorables ministres de la Santé des différents pays ici présents, Monsieur le directeur à cette occasion de la validation et du lancement de la stratégie africaine de 5 ans élaborée par Africa CDC sur les maladies non transmissibles, les blessures et la santé mentale. Monsieur le directeur général de Africa CDC, permettez-moi de vous remercier pour un travail louable que vous faites et vous féliciter de l'organisation et la réussite de cet atelier qui est une fierté pour l'Afrique tout entière. Les maladies non transmissibles, les blessures et la santé mentale constituent un fardeau pour nos pays et freinent le développement intégral de nos peuples. Une action réaliste et réalisable est donc une nécessité pour améliorer l'état du bien-être de nos populations. Mon pays et de surcroît tous les États du bloc de l'Afrique centrale ne ménagera aucun effort pour soutenir toute initiative de l'Union africaine en général et de l'Afrique CDC en particulier et s'alignera toujours aux politiques et stratégies qui visent à l'amélioration de la santé de nos populations et au renforcement de la collaboration entre les États membres. Notre pays, conscient des enjeux et les conséquences dévastatrices des maladies non transmissibles sur l'avenir du pays, du continent et du monde entier, a pris et prendra toujours des mesures visant à pérenniser les acquis en matière de la prévention et la prise en charge de ces maladies. Certains des défis persistent, mais des avancées significatives ont été déjà atteintes, surtout en matière de la gouvernance, de la prévention et de la prise en charge des maladies non transmissibles. En effet, dans ce combat, le Burundi a déjà des réalisations, notamment la mise en place d'un programme national intégré de lutte contre les maladies non transmissibles depuis 2009, comprenant un service de prévention, un service de santé mentale, un service d'oncologie, un service de prise en charge de ces maladies non transmissibles. Des plans stratégiques concernant le cancer, la maladie mentale et l'épilepsie, la lutte contre la consommation de l'alcool et le tabac, ainsi que le plan stratégique de la médecine physique et réadaptation sont déjà élaborés et validés. Le programme a son plan stratégique de 5 ans, couvrant la période de 2019 à 2023 et qui intègre les 3 principaux piliers de la stratégie mondiale de lutte contre les maladies non transmissibles, à savoir la surveillance, la prévention et la prestation de soins de santé dans le cadre de systèmes de santé. Des protocoles de prise en charge des maladies non transmissibles ont été élaborés et diffusés. Notons également une implication de l'Institut national de santé publique dans la formation, le diagnostic et la recherche en matière de maladies non transmissibles à travers le laboratoire national de référence. Des formations en cascade des prestataires de soins en santé mentale ont été intégrées à tous les niveaux du système de santé en collaboration avec nos partenaires au développement en matière de santé mentale. Signalons également que les médicaments psychotropes ont été intégrés dans notre liste nationale de médicaments essentiels. Et dans le même cadre de la lutte contre les maladies non transmissibles, un document de mise en place d'un centre national de référence en cancérologie vient d'être élaboré. Néanmoins, des défis ne manquent pas, entre autres un faible financement du secteur de la santé en général et celui des maladies non transmissibles en particulier, une insuffisance des ressources humaines en qualité et en quantité, une insuffisance d'infrastructures adaptées. chers honorables ministres, Monsieur le directeur général de l'Afrique CDC, chers participants, distingués invités, ce moment est donc une opportunité en tant qu'Africains de réfléchir sur l'avenir de notre continent pour une action multisectorielle soutenue afin de prévenir la progression des maladies non transmissibles pour consolider ensemble nos systèmes de santé d'une façon intégrative. En conclusion, chère Auguste Assemblée, je m'en voudrais de terminer mon allocution sans réitérer l'engagement indéfectible du Burundi à soutenir les efforts de l'Union africaine et de CDC Afrique et le soutien total de cette stratégie initiée dans le cadre de renforcer la surveillance, la prévention et la prise en charge des maladies non transmissibles, des blessures et des maladies mentales. Vive la santé pour tous, vive un monde sans maladies non transmissibles, vive la collaboration internationale. Que Dieu vous bénisse. Je vous remercie.
Thank you. Thank you very much, Honorable Minister from Burundi. Very wise words there. And we are looking forward to working with your country to start implementing all those very important points that you've raised. Now I would like to invite Honorable Minister from Botswana. You have the floor.
Your Excellencies, Honorable Ministers of Health present here, let me recognize the host minister, Ms. Leah Tedes. Your presence here, it means a lot for us who are visiting your country, Ethiopia. Deputy Chairman of African Union Commission, Ms. Monique Nzanga-Banga, this name is difficult for me. Commissioners present here, Director General CDC Africa, Dr. John Ngengasong, distinguished ladies and gentlemen, invited delegates, good morning. Director of Ceremony, it has been an honor to be invited to this groundbreaking workshop. I'm delighted today because we have embarked on a very important milestone in the health fraternity. This will serve as a strategic roadmap to be used by member states as guidance in the prevention and the control of non-communicable diseases, injuries, and mental health in our African continent. Your Excellencies, in line with the SDG Agenda 2030, non-communicable diseases, injuries, and mental health strategies should focus on multi-sectoral and multi-stakeholder involvement. And I applaud Africa CDC for ensuring that all relevant sectors, including people living with NCDs and mental illness, ill health, were included in the development of this strategy. This is because we know that no policy should be decided by any representative without the full and direct participation of the members of the groups affected by the policy or strategy. Hence, the principle of nothing about us without us. Distinguished delegates, I would like to briefly share my country experience, learning points, success, and challenges in our effort to control and manage the increasing burden of non-communicable diseases, injuries, and mental health. In terms of NCD governance and leadership, there has been a unit at Ministry of Health for national coordination of NCD prevention and control for the past 10 years. Botswana NCD control is currently guided by the National Multi-Sectoral Strategy for the Prevention and Control of NCD 2018. It was a 5-year strategy. The strategy was launched by His Excellency, the President of the Republic of Botswana, Mokgweetsi Eric Kiabetso Masisi. This is just to show the political will in Botswana and the recognition of the NCD as a national health challenge by the political leadership of the country. Nevertheless, we have had challenges in our implementation of this strategy because of COVID-19 and limited funds. As you are aware that we are dealing with double burden of diseases, where communicable diseases such as HIV, TB, and malaria are still trial in my country, Botswana. Regarding mental health legislation, it is my pleasure to say that Botswana is one of the countries that has repealed the Mental Disorders Act of 1971 because the gap analysis that was conducted in 2015 concluded that the said act was based on an outdated understanding of mental illness and that it was not consistent with assuring rights and protection of people with mental illness, as well as adequate treatment and care. A new bill is due to be debated in July House. I'm happy to say that my attendance here has given me a new perspective on mental health and will use that in my deliberation going forward. And I want to assure the House that once that are seated by the President, it will not gather dust. It will be put in practice. However, there continues to be a problem of data on STDs, injuries, and mental illness in Botswana. It is our hope that in collaboration with CDC, we will be able to close this gap. Data collection is still a challenge. Notwithstanding the above, I would like to assure you of our commitment as Botswana to ensure our support towards operationalization of this newly developed and validated Africa CDC 5-year strategy on non-communicable diseases, injuries, and mental health. We note that us being invited here is a timely stimulator for us to ensure that we implement all the lessons that we have learned over the past 3 days of rich deliberations here in this workshop into our national strategy. I also want to make you aware that I came with focal persons in Botswana, the one who's the focal person for NCDs and the focal person for mental health and for injuries. That's to show the seriousness of us as a country when we do, for this workshop. As I conclude, let me sincerely thank you for inviting us to this landmark workshop, and I reiterate my government's commitment to ensuring that this strategy on NCDs, injuries, and mental health, offering a maximum support to Africa CDC to be put to use. And let me declare Botswana is also part of the new public health order. And lastly, let me thank the people of Ethiopia for their hospitality. We enjoyed the peace in this in Addis as Botswana delegate. It's always nice to give feedback to people who hosted you. With those few remarks, thank you so much, Asante, merci beaucoup, and Azengalo, I felt that one is for Ethiopians. Thank you so much.
Thank you very much, Honorable Minister. When you invite us to Gaborone after the bill has been passed, we'll also learn Setswana when we come. Allow me now to invite the Honorable Minister of Gambia for his remarks.
Thank you very much, Mr. Chair. The Honorable Minister of Health of Ethiopia, Dr. Lia Tadesi, colleague honorable ministers here present, other colleagues from the control programs, focal points here present, distinguished ladies and gentlemen, allow me to use this opportunity to thank the Africa CDC through the director, the deputy director, the program officers, and all the distinguished personalities who made this meeting possible today. We are delighted to sit amongst you today to discuss these very crucial activities in the health sector. We are all aware of the challenges faced with regards to NCDs, injuries, and mental health. We have spoken about the statistics, even though there's paucity of information, but nonetheless, from the evidence gathered and anecdotal evidences, we know certainly NCDs are a big problem. Looking around the room, or any gathering for that matter, whether it is declared or not, we know there are a lot of people who are battling with NCDs, hypertension, diabetes, and other NCDs. The Gambia is committed to fulfilling its obligations to global health declarations in general and to those related to the prevention and control of NCDs, injuries, and mental health. The Gambia has taken key measures in domesticating some of the declarations and decisions arising from the UN high-level meetings on NCDs and mental health. The Gambia, as in many low and middle-income countries, is currently experiencing the double burden of communicable and non-communicable diseases and mental health disorders. Of course, as reiterated by the Africa CDC, the triple burden of injuries has become a very big challenge for us. The leading cause of death of young people in the Gambia, and as in many other countries, is injuries mainly from road traffic accidents. Certainly, the impact of NCDs, injuries, and mental health on the cream of society, that's the youth, and people in their productive ages, is felt all over the Gambia and certainly all over Africa, thereby stalling progress, development, and nation building. Our government is not relenting in putting together efforts with key stakeholders, partners, local communities, other NGOs to ensure that this area that has been neglected for so many decades gets the attention that it deserves. In our endeavors, the Gambia has been able to get some very key achievements with regards to NCD prevention and control, injury prevention and control and prevention of mental ill health. We have developed the NCD policy and strategy. A mental health policy has also been developed, and the strategy is being worked on. We have developed the Tobacco Control Act of 2016 and regulations in 2019. Tobacco Control Strategic Plan has also been developed. We are delighted, certainly, to mention to this gathering that the Gambia has put forward graphic warnings on cigarettes that we believe will make the consumption of cigarettes unpalatable for the smokers, even though, to our surprise, some people still continue to smoke. We've been able to integrate mental health services within the primary health care services. However, there have been numerous challenges we are battling with, but with persistence, we'll be able to get it fully integrated. We've been able to establish a national multi-sectoral mental health and psychosocial support committee. We also developing the mental health and psychosocial support referral pathways. And this had been necessitated and strengthened during the COVID-19 pandemic. We are developing a road safety policy. And of course, in tandem, we're also working on the strategic plan. We are delighted to have been invited to this inauguration or to this validation of the Africa CDC, the strategic plan for the control of non-communicable diseases, injuries, and mental health. I think for us in the Gambia and many other African countries, it is a unique opportunity to incorporate the strategies, the steps into our own national documents. And it is very important because we'll be able to carry out some standardization, which is very important. When we standardize and we develop peer review mechanisms, it is easier for monitoring, and it is easier to strive to get to where our colleagues, our other countries, our sister countries have gotten to. And of course, it makes it also easier for us to be able to carry the ones who are lagging behind forward. So that's why the leadership of the Africa CDC is very, very important in this endeavor. In the Gambia, we recently set up a new cancer control program. This is very important because we realize that the NCD control is lumped together. And there are very, very broad aspects of NCDs. And each of those aspects is not getting the desired recognition, the desired funding. So gradually, we are splitting it up so that we are able to get the attention and to give each area the funding that it requires. So we've established a cancer control program, and we are on the verge of establishing a trauma or injuries control prevention and control program. We believe when these are divorced from the control of hypertension, diabetes, chronic respiratory illnesses, each of them will be able to get the attention it requires, the manpower that they deserve, and the funding, because otherwise, small amounts of funds go to NCD control program, and you cannot feel the impact. So this is an idea that we developed in the Gambia, and we hope others will agree with us that it makes sense. We certainly have been having a lot of challenges when it comes to NCD issues and injuries, as well as mental health, mental ill health management and control. We have limited national capacity, both human and financial, for the implementation of the planned strategies. The serious need for specialized mental health personnel, the psychiatrists, the psychiatric nurses, the psychologists, occupational therapists, counselors, and so on, has been a big stumbling block. However, we are enhancing the training of individuals. And just this morning, I was discussing with a colleague from Rwanda who motivated me for us to enhance our training capacity. We've recently started postgraduate training, specialization training in the Gambia. And after he mentioned it, I said, on my arrival at home, we will try to initiate postgraduate training in mental health as well. Thank you very much. We have lack of availability of standalone budgets to finance mental health planned activities. But one of the outcomes of such meetings is that you get home with a lot of motivation. So, inshallah, this budget session coming, we will try to put standalone budgets for all these areas so that our people are able to work together. The marginalization and stigmatization of people with mental health is still a problem, but we plan to be advocates ourselves to talk about mental health issues more often, which we all hardly do, even as politicians. We hardly talk about mental health issues, but I think we will endeavor to talk about them, to make people know that they are just issues, health concerns as other health concerns. The COVID-19 pandemic has equally posed quite a lot of challenges when it comes to mental health and control of NCDs and injuries, with most of the health facilities being used for the control of COVID-19. However, it has also brought about quite a lot of opportunities in the sense that many people heard about psychosocial support first during the COVID-19 pandemic, and we realized that most people needed psychosocial support, including ourselves. Unfortunately, our team, the mental health program manager, is here, but he never offered the Minister of Health psychosocial support, and I'm reporting him because I thought I needed it a whole lot, even though I didn't say it. So that's the issue with mental health issues. People may be quietly suffering without saying it. So I was suffering too, quietly handling COVID-19 without saying that I needed help. In addressing these challenges, our ministry has drafted national policies and costed strategic action plans for both NCDs in 2022 and mental health 2021, as mentioned earlier. The development of these documents was indeed participatory and collaborative with contributions from various sectors, including the relevant government ministries, national and international development partners, societies, academia, and the private sector. These policies envisage a Gambia free from avoidable burden of non-communicable diseases, injuries, and mental ill health. Distinguished ladies and gentlemen, I think this is a wonderful initiative, getting all of us in Africa together to validate this document. It is a unique opportunity, and then it should be built upon, not just after the validation, the document gathers dust. Implementation is as important and probably the most important step. But the collaboration between the countries is very important. I always talk about us in Africa setting up peer review groups. If we do peer review, then we are able to pick the countries that are doing well and we emulate them. And then we also pick the countries that are lagging behind and we encourage them. And DG and Deputy DG, Dr. Ahmed, I humbly appeal that you coordinate and facilitate the interaction between your institution and the countries, but equally between the countries. We should get the information that we require. The data has to be available. One of the most important challenges we have as a continent is getting the statistics. We talk about issues, but we don't have the exact evidence, the up-to-date evidence. And a big problem is when we quote data, sometimes it's almost a decade old or 5 years old. People cannot relate to such information. We should be able to get our information updated and we look at the trend. This is what the policy makers, this is what the politicians listen to, this is what the heads of state listen to. If we take the information to him, but if the minister is not informed enough, then he certainly cannot inform the head of state. He certainly cannot ensure that the finance minister releases funds, because we do not have information. Most of the entities that get a lot of support from the central government and from partners are very good with information. So we should endeavor to ensure that we get that. In the Gambia, we are developing and very soon inaugurating the electronic medical record system and also the electronic logistic management system. We hope this will help us to be able to get the information we require. And equally, we are on the verge of launching the National Health Insurance Scheme. This, we believe, is going to be a big plus for the management of chronic diseases, because when people have to undergo catastrophic expenditure, out-of-pocket expenditure for health, which is very high in most African countries, certainly when they run out of anti-diabetic medications, psychotropic medications, antihypertensives, they will rather stay at home and default on treatment and develop the complications rather than spend the money they are supposed to spend on food, on medications. So with these words, we would like to thank all of you for giving us this opportunity to interact with you, and to our host, the host minister, and the entire people of Ethiopia for the wonderful hospitality. No one gets tired of coming to Ethiopia. Each time we are told we have a meeting here, we all look forward to coming. We get excited. To the organizers, the Africa CDC, the entire team, DG, Deputy Director, the Director, and all your team members, we thank you very much. And thank you for your kind attention. Thank you.
Thank you. Thank you very much, Honorable Minister. And on behalf of Africa CDC, let me confirm that data sharing is one of our biggest priorities. And within this year, you will see a difference in as far as access to data on the continent is concerned. Now it's my pleasure to invite the Honorable Minister from Egypt. You have the floor.
Dear Excellency, Professor John Nkingasong, Director of African CDC, Excellencies, Honorable Ministers, ladies and gentlemen, thank you very much for receiving us in such a distinguished event. And allow me to deliver a warm thanks to my respectable colleagues, Dr. Ahmed Ouma, Deputy Director of the African CDC, and Dr. Mohammed Abdulaziz, Head of Disease Control and Prevention Division, for their tremendous efforts in holding this incredible event. And allow me to stand to thank them. I extend my thanks and appreciation to all the respected speakers and moderators who enriched the event contents by their elegant contribution. And at this historical moment, we witnessed the kickoff of the African CDC Non-Communicable Disease, Injuries and Mental Health Strategy, which is considered a new milestone for the African CDC, added to the honor list of the African CDC, which is considered the home for all the member states. And after these heavy years and the pressure of the COVID-19 pandemic, one of the lessons that have been learned is the need for better healthcare preparedness for all the past and coming health challenges, especially non-communicable disease and mental health, which currently topped the list of the leading causes of mortality in the African continent and also the rest of the world. I thank all the member states representatives that shared extensively in figuring out this strategy, which I think will have a very positive impact on controlling the pandemic of the non-communicable diseases in the African continent. And after we saw this strategy come to light, we started the most complex and challenging period of implementation of this strategy over the coming 5 years. And I believe that we need many meetings to exchange our experience, share our ideas, discussing the difficulties and challenges to reach to the best outcome after the end of this initial period. I wish all the member states to take the implementation of this strategy as a top priority. I also wish that all the healthcare leaders and decision makers to act as a catalytic arm for this strategy, to reap the fruits of applying such a strategy and its expected impact on people's health. I wish, before I finish, to give you some insights from the Egyptian experience in non-communicable disease screening and management. In 2018, we conducted the most extensive nationwide screening campaign aiming for hepatitis C elimination and early detection of non-communicable diseases, which was considered the largest historical campaign worldwide. It succeeded in screening of nearly 60 million Egyptian people in the age group 12 and above, and discovered millions of people with diabetes mellitus and hypertension, and linked them to care. And faster than we previously expected, and for the first time ever, we achieved a flat trend of annual mortality between the years 2018 and 2019, compared to the past years, which we saw an incremental increase of mortality trends proportionate to the population growth. I finally need to confirm that the investment in the diagnosis and management of non-communicable diseases is considered one of the most cost-effective and cost-saving interventions that we have adopted over the past decade in Egypt. My last words are to congratulate you on this achievement, and I would love all of us to set ambitious, realistic goals to be reached through this strategy. And to remember well, a goal without a plan is only a dream, but plan without goals is a nightmare. Thank you very much.
Thank you. Thank you very much, Honorable Minister, for those very important reminders around implementation. And we as Africa CDC are going to work with all of you to ensure that we get this strategy implemented as quickly as possible. And the experience from Egypt is going to be very key in ensuring that other countries follow along the same path. It's now my pleasure to invite the Honorable Minister from Namibia.
Thank you very much, Chairperson, His Excellencies, Honorable Ministers, distinguished participants and delegates, all protocol observed. Allow me first to congratulate the AU and Africa CDC for organizing this very important workshop. I would also like to make use of this opportunity to express our appreciation for the warm welcoming and hospitality that we received from the people of Ethiopia. Allow me also, Chairperson, to bring warm greetings from the people of Namibia. I feel very honored on behalf of the people of Namibia to share remarks on this very important occasion of the validation and launching of the African CDC Non-Communicable Diseases, Injuries, and Mental Ill Health Strategy. As with a trend in the African continent, Namibia has a growing burden on non-communicable diseases. According to the 2018 World Health Organization's report, NCDs accounted for 41% of all the deaths in the country, of which 17% of the total deaths were due to cardiovascular diseases, 5% due to cancers, 4% to chronic respiratory diseases, and 4% due to diabetes mellitus. The government of the Republic of Namibia is committed to achieve the Sustainable Development Goal Target 3.4, which aims to reduce premature mortality from NCDs by 1/3 by the year 2030 through prevention, treatment, as well as the promotion of mental health and well-being. And I'm happy to report that since the outbreak of the pandemic, Namibia from the beginning also established a psychosocial mental health support pillar as part of the response team. A robust multi-sectoral action is required to address the determinants of these chronic lifestyle diseases to achieve these targets, while at the same time, the health systems need to respond appropriately and timely by increasing equitable access to quality healthcare services for the prevention and control of NCDs, injuries, and mental illnesses through the primary healthcare approach. In this regard, Namibia has adopted the WHO package of essential non-communicable disease interventions in order to integrate NCD care, injuries, and mental health care services into the primary healthcare level, empowering primary care professionals to care for NCDs patients as well as patients with mental illnesses. Integrating NCDs, injuries, and mental health care at the primary healthcare level is of critical importance, as clinics and healthcare centers are the most accessible sites for the majority of Namibians to seek care. Strengthening the health system's capacity to screen, diagnose, and control priority NCDs, injuries, and mental health and mental illnesses at the primary care level will improve the system's equity, reaching even to the most vulnerable groups, shifting the care of these patients from referral hospitals back to the primary care level. As Chairperson, Namibia's efforts to respond to NCDs, injuries, and mental health includes, among other approaches, screening, early detection, and treatment of NCDs, injuries through various appropriate models, such as palliative care. Creating public awareness remains a key component of the response to NCDI and MH. And in this regard, each year, the Ministry of Health and Social Services, in collaboration with partners, conduct NCDs awareness campaigns, which include health information dissemination on NCDI, mental health, early detection, screening, treatment, and referral for medical care and rehabilitation services. Physical exercises and healthy eating are promoted at all levels of care. Distinguished ladies and gentlemen, the African CDC Non-Communicable Disease, Injuries, and Mental Health Strategy is a very important step towards ensuring effective prevention and control of NCDI and MH on the continent. As I'm concluding, Namibia welcomes and endorses this very important strategy. It is very important for member states to translate this strategy to their local situations for meaningful implementation. There is also a need for sharing of experiences and technical assistance among countries. With those few remarks, Director of Proceedings, once again, thank you very much for your kind attention. I thank you.
Thank you. Thank you very much, Honorable Minister, and a very important reminders there as well. And we stand together with our member states to ensure we implement this strategy. And now I would like to call upon the Honorable Minister of Ethiopia, who has hosted all of you very successfully and warmly here in Addis. Honorable Minister Leah, you have the floor.
Thank you very much, Dr. Ahmed. Honorable Ministers of Health, distinguished delegates of this workshop, invited guests, and my colleagues and leaders of the Africa CDC, all protocols observed. First, it gives me a great pleasure to welcome you all to your city, Addis, and I do hope your stay so far has been enjoyable in addition to the meetings. And I'm honored and delighted to be part of this member states and stakeholders workshop to validate and launch the Africa CDC Non-Communicable Diseases, Injuries and Mental Health Strategy, and would like to start by extending my sincere appreciation to the Africa CDC for this huge milestone, and as well as for all your efforts in addressing key public health issues, including the pandemic. As you are all aware, the health agenda of our continent and our respective countries is steadily shifting towards the so-called triple burden of diseases that was mentioned earlier. The communicable, maternal, neonatal, and nutritional conditions, which rightly is the focus of our programming for several decades, is still also improving, is still a burden, with emerging burden of the non-communicable diseases and mental health conditions, and the problem of injuries aggravated by natural disasters, conflicts, and others. And the COVID-19 pandemic has unraveled the vulnerability of our health system to shocks. And it was patients with non-communicable diseases and mental health conditions that have also suffered from disruption of the healthcare, as well as from the severe COVID illness itself associated with these conditions. The government of Ethiopia has started giving priority to non-communicable diseases and mental health, particularly in the last 10 years, with the development of our health sector transformation plan and development of specific strategic plans for the implementation of integrated non-communicable diseases and mental health prevention and care services with focus at the primary health care level. Just to use this opportunity to highlight few of the initiatives we have now. We have regarding cervical cancer, which is one of the largest burden in our country. We have now at least one center per district offering cervical cancer screening and treatment services, which is a total of more than 1,000 health facilities at the lower level. We're also expanding radiotherapy services for cancer. Emergency services have been revamped through introduction of our pre-hospital care services, including our comprehensive emergency and critical care strategy. We are decentralizing diabetes and hypertension screening and management into the primary healthcare levels through task shifting and task sharing approaches. We're also working to decentralize mental health services to health centers using the mental health GAP, the MHGAP, the GAP action program. And as my colleague, Honorable Minister of Gambia said, we also have one of the strongest tobacco control laws in place, which we are implementing, although of course the implementation has its own challenges. And considering many of our NCDs require more, even though the core is still the prevention and health promotion, they require also extensive tertiary care, access to tertiary care. So we have developed a specialty and a subspecialty roadmap to improve the care for NCDs. In doing so, very encouraging results have been witnessed, but still it's a work in progress and the challenges are many. Here, I also would like to emphasize that NCDs and mental health conditions and injuries are not problems that can be solved or addressed by the health sector alone. They need the concerted efforts of multiple sectors within government and other key stakeholders like the academia, private sector, civil societies, and the community at large to ensure we address the NCDs. So we need to do more on the whole of government and health in all policies approaches to address these conditions, which are now the leading causes of suffering and death in many countries. So today I would like to congratulate and thank the Africa CDC for taking the leadership and the initiative to tackle this looming burden of NCDs, mental health and injuries, because such regional efforts are key to ensure we maintain the health gains we have achieved in the last 2 decades and also tackle the developmental obstacles to our joint goal of eradicating poverty in our continent. And this is one of the key areas of focus that we should collectively work on. But as we know, even if we have strong strategies in place, resources are key to make sure these are implemented appropriately. And we know funding is limited for NCDs. And we have to collectively work to ensure our governments allocate more resources overall for health and also particularly for this growing burden of NCDs, injuries and mental health. And also I would like to use this opportunity to call upon many of our partners, donors, to really relook into the donation or funding towards NCDs to be improved so that we can really address and tackle this global burden. I finally would like to affirm that the government of Ethiopia will continue to work closely with the Africa CDC and with member states in implementing this strategy and overall in our bigger vision and dream of the Africa Agenda 2063 for a prosperous Africa based on inclusive growth and sustainable development for the Africa we want. I thank you so much and wish you all an enjoyable rest of your stay in Addis. Thank you.
Thank you. Thank you very much, Honorable Minister. Very key reminders there on multi-sectoral action and appropriate financing for NCDs, injuries, and mental health. Having heard from the ministers, we would like to wind down today with a presentation from Africa CDC. And I invite Dr. Mohammed Abdulaziz, the head of disease prevention and control at Africa CDC, to make this presentation on our behalf. Mohammed, you have the floor.
And thank you, Dr. Ahmed. Can you share? We're trying to share the presentation so that as Adelaide is working to share the presentation, let me thank the honorable ministers for really showing excellent understanding of the mental health NCDs and injuries graphs on the continent. And let me assure you, from this very short presentation, you will be able to see that Africa CDC has taken into account every single aspect of what you've said. As Adelaide is still struggling to do that, let me say that the strategy today that we are validating, it's a bottom-top approach. What does that mean? This is actually the third consultations we are having with the technical officers in the member state. We had the first consultation right at the beginning with them to know what they consider should be the priority Africa CDC should take in terms of supporting member states with the prevention and control of non-communicable diseases, injuries, and mental health. In the second that first consultation was a kind of open consultation to look at what is the national plan of the member state and what do they consider as the comparative advantage of Africa CDC in bringing more effectiveness to NCDs, injuries, and mental health prevention and control. The second consultation was done in a more organized, let me call it quantitative way, where we synthesize what they've told us, and we now wanted to find out from the member states, okay, this is what you've told us. There are about 15, 16 priorities or objectives. What do you consider? Can you do a kind of prioritization and determining which one is urgent, which one is mid-term, which one is long-term, and then again to comment on the validity, integrity of those objectives that were presented to them. And it was an excellent meeting. Consultation, because they gave us feedback, and a lot of the member states actually shared with us their national plan, just to be sure that it gets into what we are doing. We had in that survey, we had over 40 member states responding. In the initial one, we had about 39 member states responding. Then we also did consultations with academia and researchers, research institutions, where they look at this priority and further refined it for based on what the member states have said. The final consultation was also done with people with lived experience, so that we were able to understand what they consider to be priority in the prevention and control of NCDI and mental health. Instructively, Your Excellencies, we also did a review of all what we can get in terms of research, both open source and even unpublished documents. And based on that, we also drew up the most recent epidemiological situation on the continent. And then we did a 3-country in-depth study of what is happening, just to understand the operations of non-communicable diseases, injuries, and mental health within the member states. And I think we did that in Nigeria, Rwanda, I'm trying to remember the third country. Kenya, yes, Nigeria, Rwanda, and Kenya. So it's a lot of work went into this before what we are doing today. We in Africa CDC felt that COVID allowing, let's give the opportunity to bring all the people who work in this area to sit down and now look at the whole document again before we can really call it finalized and bring Your Excellencies here to validate this this document. So this has been what we've done, and finally we've inaugurated a eminent committee of advisors, experts in self-recognized experts in this field. I will talk a little bit about them later in my presentation. So, Your Excellencies, your representatives or technical representatives have been working since Monday on this document. On Monday, they set the scene for what we'll be doing, introducing the document, though we sent documents ahead of time, 1 week ahead of time. And then we actually had excellent presentations from some of our technical advisory committee. Excellent presentation from Professor Kaushik on NCDs, and an equally excellent presentation on mental health policy, the Nigerian experience from Professor Sheikh. So went ahead into discussion of the objectives and activities, revisions. On Tuesday, we shifted gear to real validation. We had 8 breakout sessions, different parallel sessions, 4 for mental health, 4 for non-communicable diseases and injuries. And the feedback we got from these eminent people here is really have given us the hope that these documents will be member state-led and member state-owned and Africa CDC led, and we hope that it will smoothen implementation, because the feedback we got actually made us to know that we got the right people in this hall to look at the document. So on Wednesday we did, because Your Excellency, as you know, we in Africa CDC, we hold ourselves accountable. When we say we want to do something, we ask to be evaluated on it. And because we're a public health institution, we need to set timelines and evaluate ourselves. And the timeline we set here is 5 years. Therefore, on the 3rd day, we held the whole day talking about M&E, monitoring and evaluation. How 5 years from today, you will be able to assess what Africa CDC have done, and have we brought the much needed innovations that will help strengthen disease prevention and control for non-communicable diseases, injuries, and mental health. So today, after that, yesterday, we went back and we worked very hard to put everything. We've been working actually to put everything together. Today, Your Excellency, we're here to validate the strategy. So let me just introduce you to what we have now that we have put everything together. The first objective is to enhance the capacity of Ministry of Health or National Public Health Institution to develop, integrate, and implement national and supranational frameworks and policies for the prevention and control of NCDs, injuries, and the promotion of mental health. So just to give you, this is objective 1. Some of the priority interventions, and this was given to us by member state that we should change. We said priority activities. They said no, priority interventions, because we are intervening to support the member states. So some example include strengthening Ministry of Health and APHI capacities and capabilities to implement NCDs and injuries, prevention and control strategies, and ensure these are embedded into wider multi-sectorial strategies. We also have support MOH, MPHIs to develop and implement national NCDs and injuries risk communication and community engagement strategies. One of the, when we were doing our initial consultations with the leadership of Africa CDC and the African Union, was that they tasked us to have flagship initiative. Those initiatives will be what we will put a lot of resources in, even if others we do not achieve, that we want to hope to achieve. So for this objective is to support member states on the integration of non-communicable diseases, injuries, and mental health into primary and secondary health care. Your Excellencies, if you were here during the deliberation on the first day, it was quite clear that we do not have health equity when it comes to non-communicable diseases, injuries, and mental health at the primary and secondary level, especially at the primary level of healthcare in Africa. And it was a unanimous decision that this should be one of the strong area that we should try to support member states in achieving what they are doing in the community. So for mental health, that flagship initiative changed to support Ministry of Health, MPHI, to integrate mental health and psychosocial support in health emergency response and preparedness. This we chose very carefully because if you go back to the COVID-19 response, or if you even go back to the West Africa Ebola outbreak, one of the areas that was challenging in Ebola outbreak in West Africa was the mental health and psychosocial support, to the extent that WHO made that work stream a cluster on its own under the case management pillar. This is so because all your interventions to control an outbreak of an infectious or emerging infectious disease can be derailed when people feel they will be stigmatized, when people feel they are being treated unfairly, and even when you don't take care of their psychosocial needs. So that is why we felt this is important. We've seen it again in COVID, and the Honorable Minister from Gambia said something very instructive. Health workers are among the people who suffer mental health and psychosocial sequelae. First, we saw it in COVID. Health workers were committing suicide. And therefore, this component needs to be strengthened. When you see the bizarre effect of seeing patients, your beds are full, you as a health worker, you are trained to help, but you cannot help, you are helpless. And you watch your patients dying. You don't go home and sleep if you do not get help. So this is one of the reasons why this is here to ensure that we can strengthen this in the long run. So the second strategy is to advocate for political commitment to non-communicable diseases and injuries and mental health. Distinguished participants, if you look at the high table here, are we beginning to achieve this aspect? We have 6 ministers. Please, let's give them a round of applause. Let me say very clearly, we, the technical people, we need to improve on how we communicate to our political leaders, because we need to let them understand the case for what we are doing. Today, nobody will deny the case for NCD, injuries and mental health prevention and control on the continent, because our experts, our ministers equally said the triple burden that we have on the continent. In fact, in some series, you realize that for some countries, the highest mortality comes from this area. Even in Africa, though we're still battling with the communicable diseases, we cannot allow NCDs to just face away, because it is one of the main causes of death for our people. So the flagship initiative here is to support the adoption of a continental declaration by member states for the prevention and control of non-communicable diseases and injuries. And this document, Your Excellencies, we hope to take it to the highest level, passing through the AU mechanism to get it to be declared as an African Union document moving forward. And the same for mental health. It's to support that declaration by member states that in support of the promotion of mental health. The third objective is to align member states, regional economic communities and partners to establish, strengthen, and coordinate multi-sectorial actions on NCDs, injuries, and mental health. It was a unanimous decision here that non-communicable diseases, injuries, and mental health is not only a challenge, an issue for the health Ministry of Health only, because we have a ramification from the ministries of from trade and industries, from transport, from different aspects of our everyday life, education, and the rest. So, looking at the African Union Commission, the African Union Commission has some of the best departments that takes care of this issue, working with member states. So we felt we can work with the Commission, Africa CDC, as part of the Commission with member states, to put more searchlight on coordinating the control and prevention of mental health, non-communicable diseases, injuries, and mental health, using the multi-sectorial approach. Bring more needed impetus to that critically needed aspect of work. So the flagship initiative here is to establish an African Union multi-sectorial task force to lead and coordinate action across this sector. And for the mental health, the same, to develop a continental investment case for multi-sectorial action on mental health using the multi-sectorial task force. So this multi-sectorial task force is for NCDs, injuries, and mental health. The fourth objective is to strengthen workforce for non-communicable diseases, injuries, and mental health, and link them in continent-wide networks of practitioners and researchers. So we need the workforce. And as part of what we call the new public health order for Africa, workforce development in the division of Public Health Institute and Research of Africa CDC is considered one of the flagship programs of Africa CDC. We are even working with President Ramaphosa, His Excellency, to set up a continental tax team on workforce, because in the deliberations here on Monday and Tuesday, we felt that though we do not have the requisite workforce, yet we are losing the ones we have through brain drain. As soon as member states, and I'm quoting one of our distinguished participants, as soon as member states train these people to the level that they can give enough support for the country, they are moving out of Africa. So these are issues that we need to address, and it's clearly stated there that we will support NCDs, injuries, and mental health workforce development. But we want to make a flagship initiative of establishing a field epidemiology and training program, FETP, for NCDs, injuries, or if it exists in some countries, if we cannot establish a standalone NCDs mental health one, we strengthen the NCDs mental health injuries component of the existing field epidemiology training program. So just so much to be able to have the requisite workforce that can work, especially in the public health component of this thematic areas. And for mental health specifically, they want to develop a continent-wide public mental health leadership program. And of course, establish mechanism for the participation of people with lived experience, because this is a big issue in mental health. We know that stigmatization, loss of skills, and many other challenging aspects of mental, and not just mental health. Even we see it these days in non-communicable diseases and injuries. So a very important work stream for Africa CDC. The fifth objective is to develop and support sustainable continental and regional funding mechanisms for the implementation of Africa CDC strategic plan for support of member states on prevention and control of non-communicable diseases, injuries, and the promotion of mental health. We all know that if you take COVID-19, for instance, the amount of funding that have gone to COVID-19 in the past 2 years is unbelievable. But mental health, non-communicable diseases and injuries will not get that kind of attention. So we want to make this a unique objective on its own, where Africa CDC, leveraging on the fact that in this capital of Africa, Addis Ababa, host at least once in a year all African head of states. They come here. And therefore, we can use that opportunity to advocate, request them to improve funding for non-communicable diseases, injuries, and mental health. We really need to do this. It's one of it comes naturally. If the Ministry of Health and MPHIs want to cut down mortality, let me rephrase in another way. If the Ministry of Health, MPHI, want to reduce what is killing our people, we need to focus on what is killing them in the NCDs, injuries, and mental health. So this aspect it's keen, and for mental health is to secure continental, at the same thing, funding for the flagships of the Africa CDC strategic plan for promotion of mental health and well-being. The final strategy, Your Excellencies, is we all know that access to medicines and diagnostics can be challenging. One of the things that made me feel I need to leave clinical medicine was when I realized I would prescribe a drug of $10 to a patient that needed $50 to come from where the village she's staying in to the hospital and back. And after 2 visits, you don't see that patient anymore. The next time you see the patient has lost all the skills. You know that this is a big issue. Now, do we learn some lessons from the COVID-19 response, Your Excellency? When the world, including Africa, locked down for the COVID-19, many countries in Africa, especially, were running out of supplies, vital supplies for the COVID-19 pandemic. Not just for the COVID-19, for the thing about, we all know NCDs, is that you sometimes take medications for life. This person who is used to just going to his next door pharmacy and taking his antihypertensive, anti-diabetic medication, first is locked down at home. Then if he goes out, it's out of stock. But we did learn some lessons. And I'll share these lessons with you. One of these lessons is that pool procurement is one way to go. However, one of these lessons is that during this pandemic, humanitarian corridors should be left open. And in this regard, I want to share with you the experience of Africa CDC working with the Ethiopian government. When these lockdowns came, at the highest level of Ethiopian government, the Prime Minister, they worked out a system where supplies will come to Addis, and from Addis, these supplies will be distributed to every country in Africa that requires it using Ethiopian airline. That was one of the most That was one of the most, how do you call it now? One of the most impactful decisions I've ever seen in public health, because it saved a lot of countries from running out of vital supplies. Now we need to also learn how to use this kind of initiative for NCDs, injuries, and mental health. Because we do not, if whatever you're doing in this regard, if you have this kind of COVID lockdown again, and the medications do not flow, the diagnostics do not flow, it will be catastrophic for people living with these disorders. So in this respect, Africa CDC set up the African Medicine Supply Platform, which we use to facilitate vaccines and all those things supplied to member states. We champion pool procurement. But one thing I have to say here is that we cannot have security for health if 90% of what we are using, we are purchasing from outside the continent. This is critical, and that is why Africa CDC has taken the strategic decision that this must change. Local production of medicine, essential medicine, diagnostics, vaccines, and I'm saying vaccines in an NCD meeting because we have vaccines preventable cancers, don't forget that. Local productions of these materials is now the highest priority for Africa CDC. So this is why this strategic objective number 6 is critical. And whatever risk communication you do, whatever, even the doctors and nurses are useless if you don't have the medication. If you cannot make the diagnosis. We know that somebody who presents early with prostate cancer, with an excision of that prostate, can live the remaining of his life without shortening. But if it has spread, as I learned personally, the life expectancy is just 3 years. And for prostate cancer, a simple test using prostate-specific antigen test can be a lifesaver. But not many people know. Even when we know as doctors or as health workers, we don't action it. We need to get people to talk about these things. In mental health, we have family members who have mental health conditions. If you do not look at them, take care of them, they lose all their skills. So I'm sure as I'm talking here, there's nobody in this hall who do not have one person or the other with a non-communicable disease or have suffered injury or is suffering a mental health condition. So these strategies that we have developed is to see how we will support member states, honorable ministers. We are not implementing them, but we want to support member states that will be implementing this, and we will bring all the political, financial, and whatever strength of the African Union to support this in the member states. And that is why we felt it is worth it to come do this, and we've seen the value from the contributions we've gotten from our member states. So it's the same for mental health. It's to do pool procurement for mental health. If you give a child that has childhood epilepsy, 200 milligram carbamazepine in divided doses or in whatever dose that controls the fit, that may be the difference between that child growing up to develop cerebral palsy. and being useful to the society. So all of this, but if you cannot get the carbamazepine, then everything you're doing is not worth it. So, Your Excellencies, I've come to the end of my presentation, but let me use this opportunity to introduce to you the members of the Advisory Committee for Africa CDC who will be advising Africa CDC in the implementation of this strategy. The first, we have Professor Hassan Ganem. Professor Hassan Ganem, please, can you, thank you. We have Professor Taiwo Latif Sheikh. Professor Taiwo Latif Sheikh, thank you. We have Professor Abba Wakil. Professor Abba Wakil. We have Dr. Mary Awiyonzu. Dr. Mary. Thank you, Dr. Mary. We have Professor Dr. Kaushik Rawaya. Dr. Kaushik. Okay, thank you. We have Professor Agnes Binagwaho. She was not able to come, but she's been following all our work. We also have Dr. Emmanuel Mensah, who was not able to be here, but he's following on our work. We also have Professor Soraya Sidat, who was not able to make it, but also very active in what we're doing. And finally, we have Dr. Naeem Dalal. I think Dr. Naeem is here. Can you? Thank you, Dr. Naeem. Your Excellency, is also good I mentioned partners that Africa CDC have worked with in this regard. Let me seize this opportunity to thank the UK Health Security Agency, formerly known as the Public Health England. They've been our very strong partners working on this strategic strategy. In fact, we've had several lines of people who have worked with us. We've had Mary, Emily, Nina, and currently we have Sarah. Sarah is in the room. Sarah, please, can you stand up for recognition? Thank you, Sarah. And of course, Kazim and Usman, we really appreciate working with you. And we've also had the pleasure to have London School and CBM working with Julian. Julian, please, can you? Oh, Julian has left. And of course, I forgot Ian of Public Health England. Please, can you, for recognition? We've worked also with, WHO has contributed a lot. WHO was there during the partner forum, and they were part and parcel of this. Please, WHO Emro, where's WHO Emro? Thank you. And Afro, WHO Afro, thank you. They've really excellent collaboration. I tell people, Africa CDC was set up to work very closely with partners. And if you check in all what we talk about close collaboration with partners. And WHO is one of the main partners that Africa CDC work with. WAHO, West African Health Organization. In West Africa, we do that. And I also want to recognize the presence of our other regional collaborating center coordinators, now directors, Dr. Lul and Dr. Acham. Dr. Lul and Dr. Acham, and then Dr. Ayan, representing Central Africa. Dr. Ayan, thank you so much. We also want to recognize the UN Interagency Task Force on NCDs. They've been excellent working with them. We want to recognize NCD Alliance. And finally, let me also, Your Excellency, in the last remaining minutes that I have, recognize the hardworking team we have been blessed in Africa CDC to work with. All of this was done by them. Let me start first with Dr. Adelat. Dr. Adelat, an excellent, wonderful guy. Please stand up for recognition, please. Thank you, Dr. Adelat. We are indeed grateful to have you with us. Dr. Betty, please stand up for recognition. Dumsani. Jerusalem. She's not here. Elvis. Elvis, excellent guy. He's not in the division, but because we work very closely with the division of Public Health Institute and Research, he's just an excellent guy. Fabian, please, can you stand up for recognition? He's really working with us and really, did I miss anybody? What? Yes, the consultants that we took to help us in some of what we're doing. Sumaya, Dr. Sumaya, please, can you stand up for recognition? Okay. So, Your Excellencies, thank you. We've presented the strategy for you, and I think what is remaining next is for us to, for you to officially launch this document. Can you bring it there? You have the floor. Yes. So,
on behalf of all the ministers, member states here, we are officially honored to be launching and validating and launching this 5-year NCD strategy for the Africa CDC. Thank you very much. Thank you so much.
So, Dr. Mohammed, maybe another group photo in front of the Mandela. And then, yes, thank you.
So it looks like Dr. Ahmed's connection has dropped. So let me give the closing remarks on behalf of the Director of Africa CDC. The Director of Africa CDC asked me to really first and foremost thank the honorable ministers that despite their very busy schedule, understand the task at hand and join us here to validate and launch this document. He really appreciates your coming and your service to not only your country, but to Africa as a whole. So let's appreciate the honorable ministers here present. He also asked me to thank the Commission, the African Union Commission, the commissioners. This is a very busy cycle for Africa, for the African Union Commission. but those that were able to make it, the Commissioner for Agriculture, and those that also were not able to make it because of one engagement or the other. But he asked me to say a big thank you to the African Union Commission. He also asked that I say a big thank you to all the heads of departments of Africa CDC, head of divisions of Africa CDC, the other staffs of Africa CDC that have really been very helpful in moving this forward. Let me say, the departments and the divisions of Africa CDC are the ones that will be running, because if you take the surveillance component, the surveillance division will help us strengthen what we want to do. The MPHI divisions, the laboratory division, the emergency preparedness and response division will all be very helpful. So thank you so much. The division of diplomacy, Dr. Ben, he just left now. He's excellent coordination and helping to get this done. Lastly, he asked, and he was here throughout on the opening day, to thank the excellent members of the member states that have been here since Monday, working very hard, reading this document, giving contribution, insisting that what is in their national plan should align with this document, insisting that they will hold Africa CDC accountable 5 years from now, insisting that we get it right. Honorable members of this, participant of this workshop, you are the most active participant I've seen in a very long time in any workshop. Thank you so much. You deserve a round of applause. I think I may have missed out Professor Jean-Claude Mbaya. Yes, Professor Jean-Claude Mbaya, please, can you rise up for recognition? Professor Jean-Claude Mbaya. Is he here? Sorry, Prof. I just realized your name was written on the back page and I didn't turn it. Thank you so much, Prof, for the excellent work. My sincere apologies, Prof. I remembered again when I was to thank, the director asked me to thank the members of the advisory group who found time to be here and who joined online. And to let you know that the task at hand is much. We've seen the enthusiasm of the member state. Your Excellency, for this meeting, we have over 40 member states present and over 120 participants. Over 120 participants from member states. All in all, over 150 participants. And so this is big. And he asked me to really thank the members of the advisory committee for an excellent job done. Please, Professor Jean-Claude Mbaye, my sincere apologies. I just saw it now when I was speaking this. So Your Excellencies, we would like to have a group photos with you at the famous entrance of Mandela Hall. But let me just, do we have any other logistic notes? Because we want to close very early today. You can't come to Ethiopia without going around the beautiful city of Addis Ababa. You need to go. You have some excellent parks, beautiful parks. And I'm recommending because you should drop some of the DSA you've received to the local community. Please go to the stadium. You have excellent leather materials. I buy them all the time. You will not regret it. It's so beautiful. Shoes, leather jackets, and all those things. So that you mix and also enjoy the ambience of this beautiful capital of Africa. Thank you so much. Do we have any? Huh? Okay, there is a cultural dinner at 7 at Capital Hotel. Please, if you can make it, we will be glad for you to come? Any other? Those that are staying in the other hotels, we'll pick them to come to Capital Hotel. Are we paying? No, DSM?
Dr. Mohammed.
Oh, okay. Nafisa, please, can you make the announcement for that?
Yes. So after the group photo with everyone who's waiting for the DSA, if they can come back, there's some paperwork for you to complete, and then we'll effect the payments. So
yes, that people can take today off to go around and enjoy the city. Thank you, colleagues. Let's go for the group pictures. Thank you. And we still have the usual tea break and lunch, please. So you can always go there. Thanks.
Hello. Yes, I'm going to explain to you now. Okay. Okay. Hi, everyone. So you're going to receive these documents to complete now. It's very simple. We just need your personal details, right? So on the first page, you will see it says received by. Vous allez voir sur la première page, c'est écrit received by, reçu par. Et c'est là que vous allez mettre, this is where you'll put your name and your signature. Vous allez mettre votre nom et votre signature. Sur la droite, vous allez voir, c'est écrit amount. On the right, you'll see amount. That's when we will go to the bank to get the DSA, you will put the amount that you have received there, right? So for the first page, that's all. C'est la première page, c'est que ça. Votre nom, your name, signature. When we go to the bank, you will put the amount. That's it, right? Yes. Maintenant, nous allons sur la deuxième page. For the second page, it's the same thing. You just put your name, vous allez mettre votre nom et your job title. Donc, le poste que vous occupez en ce moment. D'accord? Et après, en bas ici, où c'est écrit Signature of Traveler. That's where you will sign. Vous allez signer ici. That's it. C'est tout. Vous allez signer, écrire votre nom et le... Ah, sorry. You just put your name.
Yes.
And then your job title.
Yes.
And then your signature.
That's all.
That's it. Yes. En français, donc. If you have not understood completely, you can come and find me here. I will explain. Oui. Oui. Oui? Non. Que pour vous, oui. Alors ici, vous mettez votre nom, votre signature.
C'est tout.
Pour le montant, ça sera à la banque. Une fois qu'on voilà.
On met le nom.
La signature.
C'est tout.
C'est tout.
Et ici?
Votre nom, le poste que vous occupez, c'est ça le titre, la title. Oui. Donc, si vous êtes directeur, si vous êtes au niveau du ministère, vous mettez ça. Et une signature ici. C'est tout. Oui. Ici, c'est votre nom et la signature. C'est tout. C'est tout. Et dès que vous avez fini, là, vous m'attendez parce que là, je vais vérifier avec le financier que tout est en place. Vous pouvez prendre un café ou ce que vous voulez, mais le document, vous gardez avec vous. Je vais prendre des batchs de 5 personnes pour aller vers la banque pour récupérer les paiements. Ouais. La banque, elle est là oui, oui. Alors ici, vous allez mettre votre nom et puis la description de votre travail. Donc, si vous êtes au niveau du ministère, donc la description de votre poste et puis la signature ici. Voilà, c'est tout. Okay, once you have completed the form, you keep it with you. You can stay here or you can have some coffee outside, but don't leave before you get your money, right? So I will come myself and get five people and get the payment. I just need confirmation from the finance officer that everything is in place before we go and get your money. All right, thank you. Ah oui, ah ben non, là, vous me saoulez, hein, mais non, il n'y a pas de souci. Non, ce que je veux dire, c'est, bon, une fois que vous avez rempli les formulaires, vous pouvez attendre en salle ici ou vous pouvez prendre un café, vous manger, etc., manger un truc, etc. Moi, ce que je vais faire, j'attends la confirmation du financier, que tout est en place et qu'on pourra aller à la banque récupérer votre DSA. Vous ne quittez pas le sein de l'Union africaine avant d'avoir récupéré votre DSA. D'accord? Vous restez ici. Et moi, je vais venir, je vais prendre 5 personnes pour qu'on puisse aller, voilà, pour qu'il n'y ait pas de queue là-bas, etc. Ici, si vous êtes un peu plus à l'aise, donc vous attendez ici, puis je vais prendre tout le monde. Hein? Sorry, I forgot to add just one thing. So on the second page, it says date of claim. I just want you to put today's date. On the second page, you will see it says date of claim. Just put today's date. Sur la deuxième page, c'est écrit la date de la réclamation, date of claim. Vous mettez la date d'aujourd'hui, s'il vous plaît. Je vais répéter. Sur la deuxième page, c'est écrit date de réclamation, date of claim en anglais. Vous mettez la date d'aujourd'hui, s'il vous plaît. Merci. Yes, once you complete the form, you keep it with you, and then I will come and take you to the bank to collect the money once the finances are sorted out. Yeah. So you can just have some coffee if you want in the meantime, but don't leave before getting your DSA. Thank you.
Party newcomers, let me just quickly show you what to fill. In the first page, fill your name and your signature. That's all. In the second page, fill your name, your job title, the date of claim, and signature. That's it. Let me know if you need any help.
Je vais même... Là, c'est bon. Merci.
Voilà, comme ça, toute la partie va. OK. Très bien. Thank you. Voilà, à l'angle aussi, ça sera. Ou bien, voilà, si ça peut sortir, ça sera vraiment bien. OK.